Hey guys, my name is Edmar and I'm the owner and founder at Orange County Myotherapy, where I help busy professionals heal from neck pain, shoulder pain, and back pain. Today I'm going to show you my 4-step process on how to assess the cervical spine. So lately I've been getting a lot of patients with neck issues here, and I just wanted to share with you what I do for me to get them outcomes that are positive so that you guys can do that at your office, at your clinic, or in your practice. The first thing that I like to do is I assess active range of motion. All that really means is I want to see how they move their neck. When they look up into extension, look down, flexion, rotate right, rotate left, and side bend. We all know these have fixed numbers or what's normal. So for example, flexion, you want it to be at 40, 45 degrees. Meaning if they're looking down, you want to have normal range of motion, which is 40 to 45 degrees. And then into extension, they're going to have about 75 to 80 degrees of motion. So if they look up, they should have about 75 and 80 degrees of motion. And then in lateral flexion or side bending, like this, they want to have about 40 to 45 degrees of side bending. And then for rotation, looking over your shoulder, right to left, like this, they want to have about 70 to 90 degrees. So that's going to be your reference point. If they're lacking any movement into any of those degrees, that's going to let you know that there's something impeding that, whether it's a joint issue or whether it's a muscular issue as well. Now, after you assess their active range of motion, next you're going to want to do is assess their passive range of motion. And with that, we're also going to assess tissue end feel. So the end feel of the tissue at end range. And so for all of these motions that the neck does, each end feel is going to be firm. That's going to let you know it's going to be a soft tissue stretch at the end. So that just lets you know a couple of things. Whenever you have them do range of motion, you get them to end range. So for example, if they look to your side, you apply a little bit of overpressure, and if it's a soft tissue stretch, normal. You start to feel hard on hard bony end field, that's going to let you know that there is a joint restriction or a joint issue. And I'll teach you later how I assess that as well. So once you have them do those motions, you have them do it again. Go ahead and look up, put overpressure there. Look down, apply overpressure to the left, overpressure to the right, overpressure, side bend, overpressure. And all we're assessing is how it feels. Is it hard or soft or firm? Once we're done with that, we'll do a joint and tissue texture assessment. And all we're really going to do is we're going to have them lay on the table, and then we're going to assess their joints in their neck. We're going to have them rotate as they relax. We're going to see how the joints are moving and how they are translating along the spine. That's going to give you a better idea if there is a joint issue, what joint is being affected. As we're doing that, we're going to feel the tissues of the neck, where there's the sides of the neck, the back of the neck, the front of the neck, and just to sense how that tissue feels. Is it hard? Is it dense? Is it firm? Is it grainy? Whatever you feel, that's going to give you an indication of how the tissue is being affected. And once you have all of that information, you're going to create a treatment plan. For me, I usually like to work from superficial to deep. We'll start at the upper trap, we'll get into the lateral neck, anterior neck, upper chest, in the back of the traps, down into the arm and the mid back. Once I'm done with all of that information, I go ahead and create a plan with the patient in front of me. I tell them, hey, this is the issues that I'm finding, this is the issues that I want to help resolve, and this is going to help with your pain, discomfort, or stiffness, or achiness, or your issue. And so you create a treatment plan, and then you act it out. Once you're done treating them, you're going to reassess them to see what has improved. A lot of the time, every angle has improved in its range, as well as the passive range of motion, end feel, everything gets restored. And then you're going to have the joint and tissue texture going to get significantly improved. and your patient's gonna be happy. There you have it. Today you learned how I do my 4-step process assessment for my cervical spine patients. If you found that valuable, go ahead and comment below with a thumbs up. And if you want more of these videos, comment below what other areas you'd like for me to share with you and how I treat that particular body part. Thank you and have a great day.